Okay, Amy, we are live. So I do not see the interim president on our queue yet, but as soon as he jumps on, we'll move him up to the panelist level with us.
Awesome. Thank you so much, Paula. Hi, everyone. Happy Buffalo Bills Thursday. We're almost there. I'm getting excited. Hope you all are too. So we wanted to have this session kind of as an opportunity to discuss all the things COVID, as well as our new semester that's starting, which we're so excited to see our students coming back to campus, those that are, and hearing from the ones that are remote, and answer any questions that you may have. So this is an opportunity. You have both myself and Mark Pacholec on the call, and Paula will be monitoring the chat. So if you have any questions, you can feel free to put them in the chat session. I will also we're going to send out a link for this recording, and I do have some information that I will share as we're talking here through numbers, phone numbers, some important points that we can put in to the email along with the link for the recording for this. So by all means, I say this all the time, please do not hesitate to reach out to either myself or Mark anytime you have questions. We're more than happy to answer anything. Even if you think, I'm just not clear on something, we're more than happy to clarify things for anybody who has any questions on anything. So joining us now is Interim President Reuter. Good morning, President Reuter. How are you?
Good afternoon, Amy, and thank you so much. I appreciate that so much. I appreciate everything that you're doing for SUNY Erie. And thank you for everyone that is tuning in today. My name is Bill Reuter. I am the Interim President at SUNY Erie. And thank you for all those that are maybe new to SUNY Erie, but also for all our returning students. We are approaching almost a full year since the start of our world changing due to COVID-19. We've all had to adjust our schedules, our life, our standard way of being. And I want to thank you all from the bottom of my heart in all sincerity for being flexible and willing to accept what is now our temporary new normal. Right now, we're one of the very few colleges in the region that actually started our classes for the spring on time. We started classes this past Tuesday, but we've had to make some changes to our planned spring schedule. We are eliminating our spring break and our April break, but we also are going to have Good Friday off as well as President's Day. Our semester will be ending earlier. Our semester right now is scheduled to end Wednesday, May 5th. During the course of the spring semester, we may have some changes to our instruction in order to complete the time of May 5th for our ending of the semester. We understand this is an adjustment from our normal schedule, but it is necessary to finish the semester early. We also encourage the number of our students that are struggling with the online environment. We encourage our faculty and staff to be patient in helping students who are struggling. Finally, we want students to know that we have several avenues to help if you are struggling. Talk to your professors, talk to your advisors, talk to one of our counselors. They are there, they are hoping and willing to help you. You can also contact the office, one of our deans of students that are located at each campus. Also our tutoring centers. They're all there to help you persist and be successful. The contact information for all these officers can be found on the COVID webpage, and we will also post the contact page to close out the forum today. I am hopeful, just like you are, that 2021 will be a turning point in a positive direction for all of us. The college has weathered many, many storms in the past 75 years of our existence, but we've made it through because of efforts like you have shown this past year. So thank you once again for pushing through this past year and the fall semester. I wish you all the very best of luck on a successful spring semester. Stay well, stay healthy, and most of all, stay safe. Thank you for being part of our family, our community at SUNY Erie, and go Bills, because we are going to bring it home on Sunday night. Sunday night. Thank you, and have a great semester. And we are here for you. Thanks, Amy.
Thank you so much. We appreciate you being here with us today. So as we discussed, while we're going through this, I kind of want to systematically go through everything of where we are now, where we're moving, and what's going to happen. So again, if you have any questions, don't hesitate to put them in the chat. You can also raise your hand. Paula is monitoring that. Or if you're not comfortable and don't want to do it in this form, don't hesitate to shoot me an email or give me a phone call, and we'll have my contact information at the end. So first and foremost, as we are approaching the semester, we have some requirements that I'm going to talk from a student perspective that our students need to meet in order to return to face-to-face classes. The first being that they need to quarantine 7 days prior to their return to campus. Now, I understand, and SUNY understands that, you know, our students have lives and you need to work and there's other obligations in your life. However, there is ways that you can apply for an exemption. There should have been emailed to you as an on-campus student the 7-day attestation form that you do need to fill out. Fill the form out, and if you do need to be granted an exception, such as being able to work, there is information on that form that lets you know what you need to submit to us. And our great team, who is headed by Nate Wallace, who's doing an awesome job, one of our many, many volunteers who are helping making our campus community safe. We'll get back to you and let you know where status is. He's doing quick turnaround on those, and I know many, many of our students have submitted them at this time. I think last count it was over 400, so that's great. The other part of this too is that all students and staff need to attest as a daily tracker of their symptoms as well as their travel history through the Campus Clear app. Super easy to do, takes you 2 seconds, just let us know how you're feeling. And if you're not feeling well, even if you're not coming on campus, it's good to indicate that on the Campus Clear app, because what will happen is one of our amazing contact tracers will reach out to you and just have a conversation and kind of talk through what's going on with you and let you know and give you more information that may help you make a decision on what to do with your health. The third part of this is that pool testing. So we're going to talk a lot about pool testing, but let me just start from the perspective of coming back onto campus. Every student and staff member is required to participate in pool testing 3 business days prior to the return to campus, or within 5 days of them returning to campus. Now, if you're someone who receives testing from an outside, through an employer or some other, I know we have some students that are dual admission and they're testing in another college, you can provide those test results to us and you don't have to participate in on-campus testing. It's also important to note too, that if you have tested positive for the COVID-19 virus within the last 90 days, you do not need to participate in testing. However, we do need a copy of your positive diagnostic results after that 90-day window. And that's because, as a doctor would tell you, if you did to consult a doctor when you were diagnosed, they will tell you there's a potential for you to test positive for quite a long time afterwards. Now, that doesn't mean that an individual is contagious or symptomatic for that matter. It just means they still have the virus dormant in their system. We would need a copy of that diagnostic test result, and that'll exempt you at least in that 90-day period from testing with us, and then you can continue after that. So those are the 3 things that students need to do from a COVID perspective as they're preparing to come back onto campus. If you're a student and you have not received that email, please, please, please don't hesitate to reach out to me. Send me an email right away at Yoder, YODER, @ecc.edu. Now for staff and faculty, the only difference in the requirements on coming back on campus is that we don't need that 7-day attestation form. Everyone should be filling out the Campus Clear app if they haven't already when they were coming back on campus, prior to them coming back on campus. Thanks, Mark. He's showing the good to go screen. Like I said, it's very easy. When you do come back on campus, and this goes for both staff and students, you need to go through one of our checkpoints. This is for the well-being and safety of everyone on campus. City campus, we have several checkpoints set up, one at the Flickinger Center, one at Oak Street, and one at Post Street. So what you can do is you can fill out your Campus Clear app before you come to campus and just show whoever's working that checkpoint a copy of your good to go pass. If you can't use the Campus Clear app, if you're choosing not to download it, you don't have access to a smartphone, you can do it from a computer from home though too. That's an important point to keep in mind. But if you don't and you want to have your healthcare screening, they're there to be able to do that for you as well. At North Campus, we have checkpoints set up at our B building, S building, as well as the G building. And then at South Campus, we have a checkpoint set up at building 6, which is where the gym is located. So again, everybody needs to go through the checkpoints. That's very, very important. We're doing that not only for the healthcare screenings, but also for contact tracing. So again, same thing for staff. They also want to register for testing. So we emailed out a link, which has made it a lot easier for people to just go on at their leisure and schedule a test. But if you're running into difficulties, if you have questions, please don't hesitate to call our COVID hotline testing line at 270-4679. Again, awesome team of volunteers. They're ready and willing to help you. They're answering the lines right now, and they can answer any questions. And if they don't know the answer, they will direct it up, and it usually ends up emailed to me or Mark, and we'll get right back to you. So please don't hesitate. One of the changes that we did make to pool testing this semester, and that's and it's pretty significant. So I hope everybody's all ears. In the fall semester, we would only contact you if you had a positive test. So what we did with the help of Joe Lundeen, working out some logistics, we set it up so that we are sending out negative test results. So be sure to check your email, usually about, it could be as soon as a day, but it might be 2 to 3 days afterwards. You will get a friendly email telling you, go Bills, you're negative. So it's been nice to get the thank yous and oh yay, go Bills. But we're doing the best we can to try to get that information to you a lot quicker and a lot sooner. And I understand now that more places are requiring that you have some documentation of a negative result. So we're trying to streamline it as much as possible. But I always remind everyone, I'm in higher ed. I don't have a background in the COVID world. Let's I'll be honest with you. We are learning as we go. We're tweaking things and trying to make it as convenient but as safe as possible for everyone. So those are some of the big things. So that's coming onto campus. So let's talk about the rest of the semester. So just this week, there has been some systematic changes to pool testing. And originally we were asking that students test every other week and staff test once a month for those that are coming on campus. There has now been a change, and we will be testing all of our student and staff populations on campus every week. So from a logistics standpoint, that's a significant increase from the amount of tests we will be conducting. However, from a safety standpoint, that should give everyone a little bit more of a sigh of relief. In some ways, we're looking at it from a monitoring standpoint. We're getting that information sooner. So if somebody is positive, they'll be able to isolate faster. So there will be some changes. More information will be forthcoming. We won't be starting really that new push of every week until the week of February 8th. So as we get things changed, we have to add more pool testing locations, but we will be operational on all 3 campuses Monday through Friday for testing, as well as 1 evening per week on each campus, and we'll have alternating days. So if you need evening hours and you're a city campus student, but you can only come on Wednesdays in the evening, you'll be able to go to any of our campuses to participate in pool testing. So those are some of the big changes that will be coming. So please, 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 as we always say, and Paula always reminds us, check your ECC email frequently and often. There is some really good information in there. On a fun, important note, we will be kicking off our Wednesday pause shortly too, which is our Wednesday live session, which we have fun. We have fun. You have to have fun in the COVID world. We have to laugh a little bit and smile, and we have good things still happening around us. So Wednesday pause is a great opportunity for us to connect. It's not just geared towards students either. So I encourage staff and faculty to join us as well. You hear about things that you might scan over in an email that you're hearing and learning about. We have some guest speakers that come in. We have fun games, and we always like our trivia too. So look for those emails as well. I'm going to pass it over to Mark to talk a little bit about the vaccination sites.
Thank you, Amy. Good afternoon, everyone. So we have vaccination sites, pods, point of dispensing, at the South and North campuses. They are open today. They will be open tomorrow. They will then close, and they will be open Thursday and Friday next week. Now, the operation of the pods is dependent upon getting vaccine. The county has been getting a limited amount of the vaccines. but they do have enough to operate 2 days a week. To get scheduled for a vaccine, you have to go to the state website, which we have shared with staff. That is the only way you can register to get that vaccine. Right now, they have canceled vaccine appointments for Saturday, Monday, Tuesday, and Wednesday of next week. The state system is not perfect. If you can't get in there, don't get frustrated. Check back another hour, but you can get in there. I am being told, we met with the county this morning, the director of the pods is here, and she advised us that right now they're scheduling well into February. All right, so don't be frustrated. For those of you who may be a little bit older than me, and definitely older than Amy, you will probably have better luck when you get into that site, getting into a pharmacy. It'll give you different locations. But right now, the state is partnering with Rite Aid and CVS and all over the county, all over the Western New York district. As far as how long they're going to be operating, we have been told that these vaccine sites will be at our campus through at least the end of June. Again, subject to the amount of vaccine that they are getting from the federal government and then us through New York State. Once you get your vaccine, you'll be in a waiting area. You'll have 15 minutes in there, but you'll be able to go in and register for your second dose. That second dose, the county is issuing Moderna vaccine. That second dose, you want to be scheduling in that 26 to 30 day window. 28 is optimal, but 26 to 30 day window. So that's what's, when you go in there, you want to pick that date on the calendar and then again, pick your site. Those doses, we are told, are a separate ordering process. Once you're in the system, those doses will be force-fed in the system so that you can get that second dose. Your arm will be sore for a day or two. There's no bones about it. It's a lot like a flu shot, but it's going to be a minor discomfort, but nothing you can't work through. I think that's it as far as the vaccine sites, Amy.
Thank you, Mark. Paula, do we have any questions?
As a matter of fact, we do. Okay, starting. We only have to fill out the Campus Clear app if we're coming on campus, not if we're working from home, right?
That is correct, yes. But I will say, if you do want to contact us, you can fill out the Campus Clear app if you're not feeling well and you need some sense of direction on where to go. You can fill it out based on your symptoms, and one of our contact tracers will contact you back if you do have questions.
Okay. We have a question from a student about picking up books. All of his classes are online, but he does need to pick up a book from the North Bookstore. Is there anything he needs to have to be able to get on campus to pick it up?
So keep in mind, as long as you're under 60 minutes for the weeks, because we understand people have to come into campus to, like you said, pick up your books, maybe drop off a library book, or pick up the mail, things to that extent. You still need to come through the checkpoint, fill out the Campus Clear app, or receive your healthcare screening at that checkpoint. As long as you do that, you can proceed to the bookstore, pick up your textbooks, and be able to leave campus. That's not a problem.
Okay, I'm asking for clarification on a question that just came through. But we did get another question. Ann, who is eligible for vaccines at this point?
At this point, the county is vaccinating everybody in the 1B category, 1B as in boy. That includes a lot of first responders, paramedics, fire, EMTs, education, those involved in the K through 12 grades. It does include faculty at higher ed that are in forward-facing classes. It does not include a lot of the support staff for colleges at this point, if that answers that question. The list is actually a page and a half long.
If we need clarification, I encourage the person to
they can email me or Amy. Absolutely.
So the next question that came in, there is a question about the library access. I work in the library, but I'm remote with the exception of being on site 1 day a week if a laptop is being distributed or scanning a textbook chapter. These trips generally don't go over an hour. I'm not sure where testing applies if I am remote otherwise.
So again, if you're going to be less than 60 minutes per week on campus, you do not need to be in the testing protocol. But if you're going to be more than that, even if it's coming on for meetings, then you do need to test and you do need to be on the testing list.
There are many student support personnel who see students on campus and are part of the FFECC, but are not eligible for the vaccine because they are not classroom teachers. Are we working in any way to expand that?
I'm glad you actually mentioned that. The Chancellor did mention that yesterday on getting support staff added to the list. He's talking to the governor about that. We don't have any answer back from the SUNY Chancellor on that, but that is an issue that he is well aware of.
A student has posted, may have joined a little bit late. I have 2 classes on campus. What exactly does that mean for screening?
Sure. What that means is that prior to your return to campus, you should have already received an email from us, from specifically the COVID testing at ecc.edu email address, giving you directions on what you need to do prior to your return to campus. Those include that 7-day attestation form, which includes quarantining or applying for an exemption due to work or being a health profession student. The second part is attesting to your daily symptoms and your travel history. And the third is signing up for pool testing. If you haven't received that, please send me a message in the chat here, and I will make sure that that email gets to you right away, but you should have received it already.
The college doesn't show up on the state website as a site to get the vaccine. I think it only shows state-run vaccine sites. People need to know how to get into the county site.
That's a great question. I don't have an answer for that. I will go after this session here and talk with the director for the county and see if that can be added.
When we send out the link for when we do send out the link for this recorded session, it will be a part of an email that's going out. So any questions that we still need to get answered, we can answer those questions in the body of the email. So keep an eye out for that email later today to come out to clarify anything that we weren't able to answer on the spot for you today. There's another question. Do you know anything about people who were canceled? Will they be rescheduled, or do we have to do it on our own? And that would be for the testing.
So we did talk with the county on that yesterday and today. They are working to get everybody rescheduled, and they are trying to do it in the same order. However, she did advise me that if you can get in and reschedule your appointment for the next available appointment for February, to also attempt to do that. But they are working on it, yes.
I'm not seeing any additional questions at this point, so we do encourage you to submit questions either through the chat, through the Q&A, or you can raise your hand on the site, and we will unmute your microphone. I do want to, Verlaine Quinney had actually posted a question, but I think I need a little clarification on it. So Verlaine, if you're able to, I'm gonna unmute your microphone for you to be able to ask the question that you were looking at. Verlaine, can you hear us?
Yes, I can. I was asking in regards to, it was just referenced that that there was site information to contact, but the specific information of who to contact was not given. That's what I was asking about.
Verlaine, we can include that in the email that we send out with the recording link of this. Yes.
Okay.
I hope you're doing well.
Hanging in there, COVID free.
There you go.
Looking now to see, we do have a few more that are popping in right now. Can I start to schedule my weekly COVID test online now, or wait until the week of February 8th?
Oh no, absolutely. If you're coming onto campus the week of February, if you're already on campus, you should be already scheduled for a test. If you haven't done so, we will have links. After we start going to everyone testing that week of February 8th, we will be sending more information out. That includes probably new links. If you've already tested out past these first couple weeks of on-campus classes, and you do have scheduled COVID tests, I believe that we're going to be able to honor those and build off of that bookings link that we've been sending everyone out. So by all means, go ahead. But I will tell you, we probably will be adding more times. We absolutely will be adding more time slots and more locations. So there may be times that are better aligned to your schedule and your calendar. So you may just want to wait. We have more information coming. So the biggest thing right now is if you're scheduled for your tests within this time frame, before the February 8th time, continue going to your pool test. That's the most important one right now.
So Amy, can you answer whether somebody can pre-schedule for the remainder of the semester? If they know they've got to come in and test weekly, can they schedule for multiple sessions?
I'm going to ask that people not, some people have at this point, because that bookings links does go out for the remainder of the semester. We will be adding additional times on, and we'll be sending that link out to all of our on-campus staff and students again. So by all means you can, but you might as well wait until we have that revised link go out. So as long as you're scheduled for these next couple weeks, that's the most important thing.
Okay, I'm not seeing anything new coming through. Oh, wait, I lied. Our students in the culinary program returned to campus on 2/1. Many of our students work in the hospitality industry, including our part-time faculty. How does this affect the 7-day quarantine?
So again, if they are working and they need to work, there is an exemption they can fill out. So for those students, again, this is not related to staff. This is just specific to students. They can fill out the 7-day attestation form. In that form, there's information on how to apply for an exemption to the quarantine. Now, keep in mind that quarantine then allows them to go to work. They still are required to stay home, not go out, hunker down prior to them coming to campus. This is about keeping our campus population safe. So again, they want to fill out the form, they want to apply for the exemption, and we're cranking those out within an hour. So, I mean, there's really no delay in getting those forms and those exemptions in. And usually what we require from an exemption standpoint is every industry and every business had to apply for the New York State Forward Safety Plan. We're asking for a copy of that. We want to ensure that you're working in an environment that is following the safety protocols as dictated by the Department of Health from New York State. And so that we know you're safe, you're going to come on campus safe, and that you're going to continue to test. And we're going to have another successful semester in terms of COVID. I mean, I can't emphasize enough how amazing it was in the fall, because we really were the guinea pigs. While there was other SUNY campuses that were continuing with face-to-face classes after Thanksgiving, we were the only ones in the orange zone, right? So we were in a class by ourselves, and we did it quite successfully. We never came close to that 100 threshold whatsoever. We did not have additional transmission from student to faculty member to student or staff or whatever. It was isolated incidents, and our protocols worked and our quarantining worked. So we want to continue that momentum as we move into the spring semester. And even though those numbers, they're higher now, we want to get ahead of this before we get into a situation where, we have multiples on campus, we're closing down sections early. We don't want to do that. So this is for the safety and support of continuing education this semester.
Okay. We have 2 requests asking that we resend the scheduling link out. One's a student and one's a staff member.
Yep.
And then I have another question that somebody's asking whether or not the vaccine is mandatory to all students on campus.
As far as the vaccine, it is not mandatory for students or for staff at this time. It's highly encouraged that you get it. We're living in a COVID environment. If you are at risk, if you're a little bit older, if you have some type of health issue, it's definitely going to put you in a better position to get through this semester successfully, but it is not mandatory.
Okay. No more questions coming through at this point. I do want to remind students and any staff who may be forwarding their Outlook email account from the college to a personal account, you're not see those things right now. There is something within Outlook that is blocking your emails from reaching you on a personal account. So we're going to highly recommend that you check your college email account, your ECC email account directly for any information coming out. We will be sending the link for this session out later today. It will be up on our YouTube site as well, but we're going to be putting the pertinent information that we're asking and answering on these questions here today, especially that link to registration for the people who need it. So please make sure you're checking your college account directly. Somebody has asked for can you send me the email with the certification form? Is there a certification form I'm missing? Is that a vaccine
form? Sure, absolutely.
Yeah. Somebody else jumped on and said our student services registration, our financial aid, et cetera, remains open at this point. I am bumping fearless leader Phil Struble up to the panelist level, so he can now be in on the fun of answering questions.
Let me can you hear me? All right. Yes. All student service areas at all 3 campuses are open. That would include the admissions office, financial services, registration, bursar, and the counseling offices are open Monday through Friday, 8 to 4 at all 3 locations. We also have remote services to assist with all of those as well. If you don't want to come to campus, you can, if you go to our webpage and click on the link that says prospective students on the top of the page, it gives you the email addresses and phone numbers for each of the departments that will serve you. All the directive for all departments is that they're answering emails and phone calls within 24 hours. But if you're more comfortable coming on campus, please do. We do ask and want to reiterate that you do use the Campus Clear app. Stop by the checkpoints. We are practicing social distancing and mask wearing in all of the areas. Any other questions, Paula, for me?
I'm not sure. I just had a come through. I'm not sure. I noticed when filling out the questions on the current systems that there are some that could be due to life being run down, cold, etc. Should we still be showing that we have them and not then going in for a test? I attempted to schedule a test and couldn't say so. Couldn't go, in all honesty.
Okay, so I couldn't quite hear a bit. I'm assuming this is somebody from a Campus Clear perspective there. They had symptoms. They weren't quite sure. They think it's attributed to something else.
Yeah, they think the symptoms are attributed to something else and not necessarily to their the COVID.
Okay. If they know that for certain, then they should be filling out the Campus Clear app for anything that is new symptoms. So I don't want to say that I laugh, but I do laugh because I did have some people who would contact me and say, I have a cold. And then I will talk to them 3 days later and the cold's a lot worse. And they end up going in and getting a COVID test and they're positive. If this is something that's different, out of the ordinary, assume that you do have COVID, stay home if you're sick. Please, please, please stay home if you're sick. And fill out the Campus Clear app. Honestly, one of our contact tracers will contact you that day and speak with you and kind of go over. They will also give you vital information such as where you need to go to get a test, rapid test, contacting your health care professional. But they'll kind of get you in the queue too, because you don't want to get your colleagues or your fellow students or anybody else sick. And this is how we were successful this fall, is following this procedure and being able to get ahead of things. So I understand uncertainty. I mean, we've all woken up and went, oh, I kind of feel achy today. Do I have COVID? But I mean, we all have bad nights that we don't sleep well and the pillow gets crunched underneath us and we got a pain in our neck, or you have to deal with Mark Pacholec on a regular basis and you have real pains in your neck. But, you know, those things do come up. We understand that, but that's why specifically the Campus Clear app says new symptoms. So if you're somebody who has a chronic condition like COPD and you cough, you know that your cough is attributed to your COPD. So fill it out accurately based on new symptoms, and someone will be in contact with you that day. Does that answer the question, Paula? Just because I didn't quite hear it.
It does answer the question. Sorry that my audio was breaking up a little bit. My phone is not cooperating right now.
No problem.
I don't see any additional questions in here. Does anyone else have any other questions that they want us to answer live for you?
Oh, I think Bill wants to talk, but you're unmuted, sir. You're going to get mad at me for saying that.
So on the Campus Clear app, Amy, is there a category for post Buffalo Bills victory Monday morning?
No, I think I could talk to Joe Lundeen and we could probably make that arrangement. I think I agree with you. That's a great executive decision. One of the best you've ever made, sir.
Wow, thanks. That was easy.
I'm gonna completely endorse that one as well. Yeah.
Absolutely. Well, I want to close this out. We weren't planning on having a long session, but an opportunity for anyone to kind of jump in and just ask a question. We are always here for you. So please don't hesitate to contact any one of us. Even if we don't have the answer right on the spot, we will do our best to get that to you. We have a lot of things changing, ever changing and being thrown at us. So sometimes we may say, hey, let me get a little more information on this before I give you an answer, because we want to make the best decision. And again, our focus is always going to be the safety of our community. So making the right decision, keeping people safe, allowing academic continuance through the semester, those are our goals. And we reached those this fall, and we want to continue that for this spring. So I continue to ask everybody for their patience, for their sympathy too, because this is a lot to take in. This is, such an enormous task for our students to be able to navigate a different environment that some may have never had to do before. For our faculty who are having to adjust constantly on the fly, and for our staff that have to do, so many different protocols and everything else to stay in line and keep things safe. So we are all rowing in the same boat. I know I say that all the time, but it's true. And we're trying to get to the shore. We really are. And I think we'll do it, and we'll do it successfully quite again. So I thank you. Keep your distance, wear your mask, wash your hands, go Bills, and Semper Gumby. Always stay flexible, and we will get this link out to everybody as well as some information related to the questions that were sent in. So thank you so much for joining us today.
And Dave Bohinski, I want to just say that I don't think the Interim President Reuter was referring to no school on Monday. Yes, we will be having classes on Monday. You actually have to teach your classes on Monday. But thanks for putting that out there, because we all know how excited we're going to be after the Bills win. And
we appreciate you trying, Dave.
Yes. Laura DeRue, thank you so much for recognizing Amy and Mark and the COVID team for the fantastic job you guys are all doing through this craziness, because they did actually recognize that. And to those of you who are throwing the Go Bills up there, of course it's Go Bills, no place else to go. We will, like I said, look out for an email later this afternoon. It'll have all the links in it for anything that students might need to know. As well as answers to any questions that we weren't able to answer for you this afternoon. Look out for information on the Wednesday pause, which will be kicking off in 2 weeks on February 4th or 5th, whatever that Wednesday is. Wednesday, February 3rd. Yes, Wednesday, February 3rd, 12:15. Amy and I will be live with probably some special guests that day. If the interim president is available, we'd love to have him back to help us kick off the Wednesday pause for the semester as well. And we'll be on an every other week schedule for that moving forward, with some recorded messages on the opposite Wednesdays. So keep your eyes out, check your email, wash your hands, stay safe, and go Bills.
Bye, everyone. Thank you.
Thanks, everyone.
Take care, everyone.